151. A nurse is preparing to administer erythromycin. Which potential adverse effect should be reported? 1. Diarrhea. 2. Prolonged QT interval. 3. Headache. Answer: prolonged QT interval. Explanation: macrolide antibiotics like erythromycin can cause QT prolongation, increasing the risk of arrhythmias. 152. A patient with asthma is prescribed theophylline. Which symptom suggests toxicity? 1. Diarrhea. 2. Restlessness and tachycardia. 3. Hypotension. Answer: restlessness and tachycardia. Explanation: theophylline toxicity can manifest as CNS stimulation, including restlessness, tachycardia, and seizures. 153. A nurse is educating a patient taking levothyroxine. Which statement indicates a need for further teaching? 1. I'll take it every morning before breakfast. 2. I can stop the medication when my symptoms improve. 3. I'll avoid iron supplements within 4 hours. Answer: I can stop the medication when my symptoms improve. Explanation: levothyroxine is typically lifelong therapy for hypothyroidism and should not be stopped abruptly. 154. A patient on clozapine reports a sore throat and fever. What is the nurse's priority action? 1. Encourage fluids. 2. Check white blood cell count. 3. Schedule a clinic visit. Answer: check white blood cell count. Explanation: clozapine can cause agranulocytosis, so WBC must be evaluated immediately if infection is suspected. 155. A nurse is administering adenosine for supraventricular tachycardia. What is expected immediately after administration? 1. Permanent bradycardia. 2. A brief period of asystole. 3. Tachycardia rebound. Answer: a brief period of asystole. Explanation: adenosine causes a short pause in cardiac activity, allowing rhythm correction. This is expected and transient. 156. A nurse is preparing to give 4 potassium chloride. What is an appropriate administration guideline? 1. For push over 1 minute. 2. Dilute and infuse slowly via 4 pump. 3. Mix with normal saline and give rapidly. Answer: dilute and infuse slowly via 4 pump. Explanation: for potassium must never be given as a push and should be diluted and infused slowly to avoid cardiac complications. 157. A patient receiving enoxaparin asks why lab monitoring isn't required. What is the best response by the nurse? 1. It's a short-acting drug. 2. It doesn't affect clotting factors. 3. It has predictable therapeutic effects. Answer: it has predictable therapeutic effects. Explanation: low molecular weight heparins like enoxaparin have predictable pharmacokinetics and typically don't require routine lab monitoring. 158. A nurse is reviewing prescriptions for a patient taking digoxin and furosemide. Which finding is most concerning? 1. Potassium 3.1 milliequivalent/L. 2. Apical pulse 65 bpm. 3. Urine output 600 milliliters per day. Answer: potassium 3.1 milliequivalent/L. Explanation: hypokalemia increases the risk of digoxin toxicity. Potassium level should be corrected before administering digoxin. 159. A patient reports drinking alcohol while on metronidazole. What is the nurse's most appropriate response? 1. You may feel sleepy. 2. There is a risk of a severe reaction. 3. It may increase effectiveness. Answer: there is a risk of a severe reaction. Explanation: metronidazole can cause a disulfiram-like reaction with alcohol, including nausea, vomiting, and hypotension. 160. A nurse is preparing to administer oxytocin to a laboring patient. What is the nurse's priority before administration? 1. Ensure 4 access. 2. Monitor blood glucose. 3. Assess fetal heart rate and contractions. Answer: assess fetal heart rate and contractions. Explanation: oxytocin stimulates uterine contractions, so fetal monitoring is essential to detect distress or hyperstimulation. 161. A nurse is administering lisinopril to a patient with hypertension. What is the most important assessment prior to administration? 1. Heart rate. 2. Blood pressure. 3. Respiratory rate. Answer: blood pressure. Explanation: lisinopril is an ACE inhibitor used to lower blood pressure. It should not be administered if the patient is hypotensive. 162. A patient taking lithium reports nausea, tremors, and confusion. What is the nurse's priority action? 1. Administer the next dose. 2. Check serum lithium level. 3. Encourage fluid intake. Answer: check serum lithium level. Explanation: these symptoms suggest lithium toxicity, which must be confirmed with serum levels before continuing therapy. 163. A patient receiving vancomycin via for complains of itching and redness on the face and upper body. What is the nurse's best action? 1. Stop the infusion and notify the provider. 2. Slow the infusion rate. 3. Administer an antihistamine and continue at the same rate. Answer: slow the infusion rate. Explanation: this is likely red man syndrome, a common reaction to rapid infusion of vancomycin, managed by slowing the rate. 164. A nurse is teaching a patient prescribed alendronate. Which instruction is essential? 1. Take with food. 2. Lie down after taking it. 3. Remain upright for 30 minutes. Answer: remain upright for 30 minutes. Explanation: alendronate can cause esophageal irritation. Remaining upright reduces this risk. 165. A patient on long-term corticosteroid therapy is at increased risk for which condition? 1. Hyponatremia. 2. Osteoporosis. 3. Bradycardia. Answer: osteoporosis. Explanation: corticosteroids decrease calcium absorption and bone formation, increasing the risk for osteoporosis. 166. A nurse is giving atropine preoperatively. What is the expected effect? 1. Increase respiratory secretions. 2. Dry oral secretions. 3. Lower blood pressure. Answer: dry oral secretions. Explanation: atropine is an anticholinergic that reduces secretions and prevents aspiration during surgery. 167. A patient is prescribed doxycycline for an infection. What instructions should the nurse include? 1. Take with milk. 2. Avoid sun exposure. 3. Take at bedtime. Answer: avoid sun exposure. Explanation: doxycycline increases photosensitivity, and patients should avoid sun or use protection to prevent burns. 168. A patient taking MALIs asks about dietary restrictions. What food should the patient avoid? 1. Milk. 2. Aged cheese. 3. Apples. Answer: aged cheese. Explanation: foods high in tyramine, such as aged cheese, can cause hypertensive crisis when taken with MALIs. 169. A nurse is reviewing lab results for a patient on carbamazepine. Which value requires immediate action? 1. Sodium 135 milliequivalent/L. 2. WBC count 2, 800/mm, superscript 3. 3. Platelet count 200, 000/mm, superscript 3. Answer: WBC count 2, 800/mm, superscript 3. Explanation: carbamazepine can cause agranulocytosis. A low WBC count is life-threatening and requires urgent intervention. 170. A patient taking phenytoin has a phenytoin level of 25 micrograms per milliliter. What is the nurse's best action? 1. Administer the next dose. 2. Hold the medication and notify the provider. 3. Double the next dose. Answer: hold the medication and notify the provider. Explanation: therapeutic phenytoin levels are 10 to 20 mcg/ml. A level of 25 indicates toxicity. 171. A nurse is administering subcutaneous enoxaparin. What is the correct technique? 1. Aspirate before injecting. 2. Inject into the deltoid muscle. 3. Do not expel the air bubble. Answer: do not expel the air bubble. Explanation: The air bubble ensures the full dose is delivered and helps prevent bruising at the site. 172. A patient taking amiodarone develops a persistent cough and shortness of breath. What is the priority nursing action? 1. Encourage coughing and deep breathing. 2. Discontinue the medication and notify the provider. 3. Continue the medication and reassess in 1 hour. Answer: discontinue the medication and notify the provider. Explanation: amiodarone can cause pulmonary toxicity. New respiratory symptoms require immediate discontinuation and evaluation. 173. A patient is starting bupropion for smoking cessation. What should the nurse monitor for? 1. Seizures. 2. Weight gain. 3. Bradycardia. Answer: seizures. Explanation: bupropion lowers the seizure threshold, especially at high doses or in predisposed patients. 174. A nurse is educating a patient on levodopa-carbidopa. Which statement shows understanding? 1. I will take it with high-protein meals. 2. It may cause dark urine. 3. It will cure my Parkinson's. Answer: it may cause dark urine. Explanation: levodopa can cause harmless discoloration of urine and sweat. However, high-protein meals should be avoided. 175. A patient with cancer is receiving ondansetron. What is the most important side effect to monitor? 1. Constipation. 2. QT prolongation. 3. Increased appetite. Answer: QT prolongation. Explanation: ondansetron can cause QT interval prolongation, increasing the risk for serious arrhythmias. 176. A patient is prescribed sucralfate. When should it be administered for maximum effectiveness? 1. After meals. 2. Before meals. 3. With antacids. Answer: before meals. Explanation: sucralfate works by coating the stomach lining and should be taken before meals for best protection. 177. A patient receiving isoniazid for TB is also prescribed pyridoxine. What is the reason for this combination? 1. To enhance absorption. 2. To prevent peripheral neuropathy. 3. To reduce nausea. Answer: to prevent peripheral neuropathy. Explanation: isoniazid can cause vitamin B6 deficiency leading to neuropathy. Pyridoxine prevents this. 178. A patient on clonidine abruptly stops the medication. What is the primary concern? 1. Sedation. 2. Rebound hypertension. 3. Bradycardia. Answer: rebound hypertension. Explanation: sudden withdrawal of clonidine can lead to a dangerous spike in blood pressure. 179. A nurse is administering for morphine. What is the priority assessment? 1. Blood pressure. 2. Respiratory rate. 3. Bowel sounds. Answer: respiratory rate. Explanation: opioids can cause respiratory depression, so respiratory rate must be closely monitored. 180. A patient taking hydrochlorothiazide reports muscle cramps and weakness. What lab value should the nurse check? 1. Calcium. 2. Potassium. 3. Chloride. Answer: potassium. Explanation: thiazide diuretics can cause hypokalemia, which leads to muscle cramps and weakness. 181. A nurse is caring for a patient receiving digoxin. What is the priority assessment before administration? 1. Pulse rate. 2. Blood pressure. 3. Respiratory rate. Answer: pulse rate. Explanation: digoxin can slow the heart rate, so the nurse must assess the pulse to ensure it is not below 60 bpm before administration. 182. A patient on warfarin therapy is about to undergo surgery. What should the nurse monitor prior to the procedure? 1. INR. 2. Platelet count. 3. Hemoglobin level. Answer: INR. Explanation: the International Normalized Ratio, INR, measures the therapeutic effect of warfarin. It must be monitored to ensure safe surgery. 183. A patient taking warfarin asks about vitamin K-rich foods. What is the best response? 1. You can eat them freely. 2. Limit them to small amounts. 3. Avoid them completely. Answer: Limit them to small amounts. Explanation: vitamin K can interfere with warfarin's anticoagulant effect, so it should be consumed in consistent, small amounts. 184. A nurse is teaching a patient about oral contraceptives. Which statement shows understanding? 1. I can skip a dose if I forget. 2. I should take them at the same time every day. 3. I need to take them with food. Answer: I should take them at the same time every day. Explanation: consistent timing maximizes the effectiveness of oral contraceptives and reduces the risk of pregnancy. 185. A patient receiving 4 potassium complains of burning at the injection site. What should the nurse do? 1. Slow the infusion rate. 2. Discontinue the infusion immediately. 3. Change the 4 site. Answer: slow the infusion rate. Explanation: potassium infusions can cause irritation at the injection site. Slowing the rate can alleviate the discomfort. 186. A nurse is administering nitroglycerin for chest pain. What should the nurse assess first? 1. Blood pressure. 2. Heart rate. 3. Respiratory rate. Answer: blood pressure. Explanation: nitroglycerin dilates blood vessels, which can cause hypotension, so blood pressure must be monitored before and after administration. 187. A patient is prescribed hydrochlorothiazide for hypertension. What is the priority nursing intervention? 1. Monitor potassium levels. 2. Monitor blood glucose levels. 3. Monitor sodium levels. Answer: monitor potassium levels. Explanation: thiazide diuretics like hydrochlorothiazide can cause hypokalemia, so potassium levels should be closely monitored. 188. A patient is prescribed methotrexate for rheumatoid arthritis. Which instructions should the nurse provide? 1. Take it with milk to reduce stomach upset. 2. Avoid alcohol while taking this medication. 3. Increase your folic acid intake. Answer: avoid alcohol while taking this medication. Explanation: methotrexate can cause liver toxicity, and alcohol can exacerbate this risk. 189. A patient taking hydrochlorothiazide and digoxin reports nausea and vomiting. What is the nurse's priority action? 1. Check the blood pressure. 2. Check the potassium level. 3. Administer an antiemetic. Answer: check the potassium level. Explanation: both digoxin and hydrochlorothiazide can cause hypokalemia, which can increase the risk of digoxin toxicity. 190. A patient receiving morphine via patient-controlled analgesia, PCA, is drowsy and has shallow breathing. What should the nurse do? 1. Administer naloxone. 2. Increase the PCA dose. 3. Encourage the patient to increase fluid intake. Answer: administer naloxone. Explanation: drowsiness and shallow breathing are signs of opioid overdose. Naloxone is the antidote to reverse respiratory depression. 191. A patient receiving diuretics is at risk for which electrolyte imbalance? 1. Hyperkalemia. 2. Hypokalemia. 3. Hypercalcemia. Answer: hypokalemia. Explanation: most diuretics, especially loop and thiazide diuretics, increase potassium excretion, leading to hypokalemia. 192. A nurse is preparing to administer insulin to a patient. Which action is correct? 1. Shake the vial to mix insulin. 2. Inject air into the insulin vial before drawing. 3. Draw insulin into the syringe before preparing other medications. Answer: inject air into the insulin vial before drawing. Explanation: injecting air into the vial before drawing insulin prevents a vacuum from forming and allows for easier withdrawal. 193. A patient on antidepressants asks about sexual side effects. Which medication is most likely to cause sexual dysfunction? 1. Sertraline SSRI. 2. Bupropion NDRI. 3. Mirtazapine TCA. Answer: sertraline SSRI. Explanation: SSRIs like sertraline are commonly associated with sexual dysfunction, including decreased libido and delayed orgasm. 194. A nurse is caring for a patient taking ACE inhibitors. Which side effect should the nurse report immediately? 1. Dizziness. 2. Cough. 3. Angioedema. Answer: angioedema. Explanation: angioedema is a serious side effect of ACE inhibitors that can cause airway obstruction and requires immediate intervention. 195. A patient receiving heparin has an APTT of 90 seconds. What is the nurse's next action? 1. Administer the heparin as scheduled. 2. Stop the heparin infusion and notify the provider. 3. Increase the heparin dose. Answer: stop the heparin infusion and notify the provider. Explanation: an APTT of 90 seconds is above the therapeutic range for heparin, indicating the risk for bleeding. 196. A nurse is administering a dose of acetaminophen. The patient's liver function tests are elevated. What should the nurse do? 1. Administer the dose as prescribed. 2. Contact the provider for a dose adjustment. 3. Discontinue the medication immediately. Answer: contact the provider for a dose adjustment. Explanation: elevated liver function tests suggest impaired liver function, and acetaminophen can be toxic to the liver, requiring dose adjustment. 197. A nurse is teaching a patient taking warfarin about potential drug interactions. Which over-the-counter medication should the patient avoid? 1. Acetaminophen. 2. Ibuprofen. 3. Vitamin C. Answer: ibuprofen. Explanation: ibuprofen can increase the risk of bleeding when taken with warfarin, so it should be avoided. 198. A nurse is caring for a patient receiving an opioid analgesic. Which side effect should the nurse prioritize for monitoring? 1. Urinary retention. 2. Respiratory depression. 3. Nausea. Answer: respiratory depression. Explanation: respiratory depression is a life-threatening side effect of opioids, requiring close monitoring and immediate intervention if it occurs. 199. A patient taking sildenafil for erectile dysfunction complains of chest pain. What is the nurse's priority action? 1. Monitor for further symptoms. 2. Administer nitroglycerin as prescribed. 3. Contact the provider immediately. Answer: contact the provider immediately. Explanation: sildenafil should not be taken with nitrates due to the risk of a dangerous drop in blood pressure, so the provider should be contacted immediately. 200. A patient prescribed furosemide asks why they need to increase their potassium intake. What is the nurse's best response? 1. It helps prevent dehydration. 2. It prevents low potassium levels. 3. It helps with medication absorption. Answer: it prevents low potassium levels. Explanation: furosemide is a diuretic that can cause potassium loss, so increasing potassium intake helps prevent hypokalemia.